welcome to another episode of E-Chat with EJ, the energetic EJ. Yes, I'm so happy to be back again. Thank you for watching the last episode. Thank you for subscribing. Thank you for liking, sharing, and commenting. God bless you. And if this is your first time on my YouTube channel, please click on the subscribe button and also turn on your notifications so that you are alerted every time my videos drop. I really do hope that it's been a pleasure, being subscribed to this channel. I'm open to your suggestions. I'm open to your comments and to your supports in any way that you can support me. So on this episode today, we are going the health way. Oh yes. Well, one aspect of health, right? So today we're going to be talking to a dentist in the house, and we're going to be covering dental care for adults. So, brothers and sisters, gather around. Let me see. My teeth, okay. All right, so we'll be talking to a dentist today, talking about dental care for adults. So sit back, relax, grab a cup of juice, a cup of water, a cup of coffee, if you are a coffee person, and let's dive in. We'll be right back. Welcome back. So today on the show, I'm going to be talking or chatting with Gloria Kasi Arinze, who is a dental therapist with special interest in dental health advocacy and promotion of self-confidence. Her interest in these areas were as a result of her several encounters with people through online and offline in-office practice engagements. She's popularly known as the confidence seller, simply because she helps people see the correlation between their dental and general health. Thank you for coming on board, Gloria Kasi. Yes, so my guest is finally here. How are you doing, Gloria?
I'm very well, Ma. I'm so happy to be on this platform too. I'm very well.
Wow, you're looking so chubby and fresh. That's so good. Motherhood looks great on you, girl.
Africa.
Yes. Yeah, you were saying something before it went breaking.
Oh, you were talking about my look. I said African queen, like I'm really representing Africa.
Nice. Yes, so me too. I'm representing Africa today. Fantastic.
Yeah.
All right, so today we're talking about dental care for adults. So first, like, I know in our chat, in our discussion, like, okay, what inspired you into choosing dentistry? You're like, I really didn't plan it. So tell me, how did you end up being a dental therapist?
Okay, at first, like I told you earlier, I didn't plan it. I didn't choose the path. Okay, it was admission wahala in Nigeria. That's the truth. I must be frank. That's the truth. At first, I was really quite confused when I left secondary school, like on what to do. The first time I ever applied for JAM, I went for an engineering course.
Oh, okay.
Yeah, so but when it didn't work out, I sat back, I thought of it again. My people giving me options. Don't you think you should try this? Don't you think you should try that? That was what was going on and all of that. So this particular jam, I decided to try out. Like I just feel it reluctantly like that. Even when the results of the post UME, as they used to do then, came out, and somebody told me that my name was published, I wasn't excited. Like that wasn't what I was expecting. Like I had other, expectations and all, but finally, I said, okay, let's just try it out. Let's see how it goes. Actually, there was another school I had in mind. I think it was University of Uyo. Yes, I had in mind there. So the post-UME and admission list came out. My name wasn't there. So I was upset at first. But this other one, my name was there and all of that. My admission was ready for me to go accept it. It was actually my mom. I was like, okay, since we are waiting for you, why don't we just pick up this one? If you knew your finally works out, then you can drop the other one and go for the one you want. That was what she told me. And I thought of it and it made sense. Okay, now had to. And that was what I just continued with. I didn't even bother checking
So are you saying that
anything.
now you love it? Is that why you stuck to it? Like, do you?
Oh yes. Oh yes, I do because ah I do. That's just the truth. I can't imagine myself
So at what?
applying for no, no. This is way better for me. Like I love this now. So that's why I told you I didn't choose it. I just, it just
Just
happened and
happened.
I took interest. That's why we are here. Yeah.
So at what point were you now definitely sure, like, you know what, this is it for me. I love, this is what I want to do, because I love what you're now doing with it. You're now tying it to confidence, and having a whole brand in that, being a self-confidence advocate. So at what point did you decide that, you know what, I didn't plan for this, but this is it, and this is how we're going to start taking it further and further and expanding it?
I think that was in my second year at school. Because one thing, I think my major backbone then in school was my mom. Because then she kept asking me each semester, so how are you doing? How do you feel about the course? This and that,
Wow.
And at some point, that was in my second year precisely, I started seeing another angle to this, and I actually started seeing another um another angle, like, oh,
Sean.
you can actually achieve something with this. It's not just the normal kind of thing that others have always been. And sincerely speaking, most people that study this same course with me, they don't want to practice. That's
Wow.
the sad truth. Yes, they
Wow.
don't want to practice. They're like, what is in this? There is nothing in this and all. Most people are doing so many other useful things to them and all. Well, that was in my second year. I really said, let me put my mind in this. At least if I give it my very best shot and it turns out not working out, then I know I've tried. Then I can,
Mm,
try
mm,
something else and all. But
mm.
since I put my interest in it, I've not had any reason to say it's
Okay.
not working out, you know.
Nice.
So that's actually it.
Fantastic. So tell us, what do you think? Like, because we're covering, dental care in adults. So what are these things that we should look out for when it comes to our dental health?
See, there are a lot of things, but I'm just going to delve on or major things that we as adults are supposed to know about our teeth. There are little things here and there, but when you pick them up, it makes a whole lot of sense. As little as brushing, There are some people, I've actually heard a lady very beautifully tell me that she only brushes thrice in a week. And she was
What?
proud. I'm not joking.
Are you serious? Is that healthy?
It's so hilarious to me right now, but that's the truth. Like
Is
she
that
she
healthy?
she said it with confidence, like she brushes thrice in a week. That's even the thrice that she's trying, like, and I'm just there looking at her. I'm like,
Like what?
really?
But is it healthy to do that though? Like
But
maybe she
this
has a
everything
reason.
and all of that.
Does she have a reason
Oh
for
my
that?
god. She said it's just doesn't make sense brushing every day. Like doesn't make sense. That's 3 times. Like she doesn't have she to me, she didn't really have a major reason for not
Oh,
doing that.
wow.
This is just what she chose for herself. That 3 times a week
Interesting.
is super, like you should clap for her.
That's
Oh my god.
interesting.
So okay, that's what I was saying. Brushing, as little as brushing the teeth for adults. For children, especially when they are still at the breastfeeding stage, it's just breast milk. Even though you don't clean their mouth, there is really nothing going to go wrong. But when you start introducing them to other foods
Mm.
and all, and they have teeth, man, you have to clean it because there are a lot of things going on in this our mouth that we don't even know. about. We don't see it on the physical, but things are really going on there. So first of all, brushing makes sense. And brushing, not just brushing every day. Like, I know sometimes when you say brushing twice a day, people feel it's luxury and all. I'm not imposing it on you. Just try and brush once. Just
At
one
least.
like this. Just brushing one like this is okay. But if you can, it's really okay. You at least make it up to twice a day. How we say it, you must brush twice a day, or if you want to brush twice a day, is before you go to bed at night, when you're done eating all your rishis for the day, and make sure before you go to bed, make sure you brush your teeth. Then don't eat any other thing except water. Keep taking drinking water and all. But if it's for any meal, please don't do it after brushing. Then if you've brushed in the night, when you wake up in the morning, just gargle with clean water. That's okay. Then go for your breakfast. Wait for some minutes, maybe like 10 to 15 minutes before you brush in the day. But I get some questions from people asking me, okay, what if I don't want to take breakfast this morning before stepping out? What do I do? Okay, if you know you're stepping out in the morning and you don't want to take breakfast, you can just go ahead and brush your teeth before leaving in the morning. There's no harm to it. Then the second thing is, when people brush, most of us forget our tongue. The tongue is very important. It's also very important part of the mouth that even when you're done brushing and okay, so about the 12, it's still part of the mouth. Anytime you're done brushing and you don't remember the tongue, it doesn't make any sense because bad breath can still come up, and you have all these white coatings around the tongue. It doesn't really look good to the eyes, even when you're talking to somebody and a lot of things are just there glaring at the person's face. It doesn't really feel good. So then, when we talk about brushing, I just want to talk about everything brushing so that maybe I'll move to the next point. When we talk about brushing, there are important things we also need to know. Brushing with the right toothbrush. There are a lot of people, or some people, I know that uses, some people I know that use only one toothbrush for the whole year, like 12 months. One was telling me that, no, this toothbrush is too fine. I can't throw it away. Okay, so you see, it's not like, yes, I know sometimes there are these kind of attachments you may have to a certain kind of toothbrush, possibly because of the comfort you feel while using it and all. But it's not really advisable that you use a toothbrush for the rest of the year. Even if you can't do every 3 months, it's supposed to be changed every 3 months. You call for a change and all. Even if you can't, just try at least twice in a year. But the ideal thing is every 3 months. Or we also advise that anytime you recover from a major illness, just make sure you change so that you don't infect your body with the toothbrush you were using back then while you were ill and all. So that is basically what it is. Then the next thing you need to know about brushing is brushing correctly. Brushing correctly. There's a way to doing it though. Because I know some yeah, a lot of people we brush vehemently. Like there's this viral video we saw one time acting like, oh god, this thing must get out of my teeth and all. Sadly, those things you want to get out some of the times, you can't get them out with a toothbrush. The basic reason we brush is to maintain good breath. But being that probably you've not seen a dentist for all your life, there are already particles, flakes, or and calculus, tartars, inside different places in the mouth. So you just brush to step down the bad breath, but you don't get those things out necessarily by brushing. So another advice for dental care in adults is that at least twice in a year, try and see a dentist, whether or not you have toothaches, because people will be like, nothing, they worry my teeth now. And once I go visit the dentist now, the problems will come in. That's a fallacy. It's not true. Okay, so if you walk into any dental clinic any time of the day, just have a check. Have a check. What is going on in my mouth? How are my
Mm.
teeth faring and all of that? It actually helps you stay away from major illnesses and all of
Yeah.
that.
I remember the
And some
first
people
time,
also share.
I think that should be like 2016 or so. That was the first time I visited a dentist in my life. You
So
know,
imagine all the food you've eaten over time and all of those
at that,
wishes
I'm
and
telling you,
palatable
at that point I
hygiene.
think at that point I had serious case of plaques or plaques. Yeah, like
Yeah,
it was really, really so. All my down teeth were brownish, and I didn't feel comfortable and all of that. But it wasn't even something that I intentionally. It was just something out of the blues. Like, you know what? Let's just even visit a dental because let's see, we can afford it at that point. You know, like, let's just go. But you know, one thing the dentist said, you know, when after checking, apart from the plaques, we're like, oh wow, like you really, really take care of your teeth well. Like you are really taking care of it. That was the report I got. And so that's to affirm what you're saying. Like sometimes, of course, there might not be any um pressing issues, but it's just good to know that okay,
ex-
you are okay, so that you won't wait until there is an
yeah,
emergency, and by the time your body is alerting you that there's something wrong, it's already far gone. So yeah, I agree that we should check, but
yeah.
I haven't checked since
Yours is actually
except from the
very
time when you came to Ghana in in 2017. That was the last time I did my plaque remover again.
a lot. Oh, okay, so you are long overdue too. Dear Lord. Ah,
I
that's
agree.
so
I
cool.
agree.
Okay, okay, okay. I wanted to say something. Yours is that you actually noticed that you weren't comfortable with the discolorations on your teeth. There are actually people that don't know that those things are not part of their teeth. Yes, we've had cases of patients that maybe you're trying to remove calculus or tatters from their teeth, and they're telling you, ah, doctor, you are pulling my teeth. Why are you pulling my teeth? Like, you're pulling it. And you, in my mind, you're just smiling and laughing because you know that this person is ignorant of what you're doing. But at the end of the day, the person looks at the mirror and you're seeing the new you, like the way your teeth should be and all of that. And you're like, oh, wow, really? So it can actually be done. Someone actually said, ah, this is my teeth is not white, it's yellow. This is how it is. This is how God gave it
My
to me.
natural
Until she
color.
did the I'm telling you, until she did the basic thing, and that was how she found out that, oh, really? So this thing I actually have believed over the years that the color of my teeth, it's not really what it is. You know, so there are a whole lot of things. And even I advise that anything you don't understand going on in your mouth, instead of asking your neighbor that is not a professional, a dental professional, it's really important you ask the person that you know that knows her opinions well in that area. Because sometimes people will be like, use this concussion, use this one, use the other one. And at the end of the day, you even complicate issues more than it's supposed to have gotten to, you know. And it's more it's more rampant with us. We always come to the clinic or call for help when it's really sometimes it's gone, it's stretched, or yes, or when it's too late, you know, you
Yeah.
won't really think of it as the first thing to do once something is doing is happening in your mouth. Be like, ah, my friend Sandra tried this thing the other time, and you don't really
What
know what Sandra, why they told Sandra to do
to
what
do
she did and
that?
all of that, you know.
Mm.
So it's really, really important. And even as an adult, if you have children, you can start taking them to the clinic or to a dentist as little as from age 1. Because I know even some adults, they have this phobia around the dental clinic. They just feel that once you come there, is to remove. But that's
Mm.
not the truth. Even when there is a hole or when you have a curious tooth, it's not necessarily that we're going to pull it out for
Out.
you.
Mm.
Basic examinations will be carried out, a lot of diagnosis and all of that. then the doctor you're meeting at that point, or the dentist tells you, okay, these are your options. You weigh it and give in your consent for the very treatment you want. So dentists are not, yeah, what do I call it now? They are not evil people, like people say, like, no, 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 kind of experience I had with the dentist, this and that. And it's true, sometimes you may have had an awful experience in the past, but that doesn't mean you should close the door to it, because you still
Great.
have teeth in your mouth and you want
Mm.
to enjoy food, meat, anything, even speech to talk. Because sometimes when you
Yes.
don't have everything you need in there and in the right position to even communicate confidently. That's why I chose that aspect. Self-confidence. First
Mm.
of all, there's a way your mouth will be. I remember in my primary school, one lady or a girl then that was in my class at all. A lady, and she's talking to you, she's always like this. She's always like this because she has a lot of discolorations in her teeth. Yes. So that's also, that kind of person doesn't have the confidence she needs to come out and talk to people, you know. And it's a very bad thing for anybody, whether a lady or a guy, not to have the confidence you need. That's actually why I go by the name the confidence seller, because I know sometimes when you use the word dental or dentist, people get scared and all. So, but
Mm.
with this other name, I can be able to penetrate a lot of people and talk to you, about your teeth and all of that, so that you can enjoy life while you still have breath in the streets.
Wow, fantastic. Thank you so much for explaining that. So I have these questions about clicking jaws. What do you know about clicking jaws? Clicking
Okay.
jaws.
Yes, like there was a post I made some time ago about the jaw too. There are people that find it difficult to open their mouth wide or to even talk the way I'm talking now. It's very difficult for them to flow and talk well. Not because they don't know what to say, but because they have a pain around their jaw area.
Okay.
Maybe sometimes it could be caused by accident or just dislocation and all of that. So that's what I was trying to say earlier, that as little as the mouth is or the teeth are, anything that goes wrong with it can affect every other part of the body.
Mm.
Yes, as little as, okay, having swelling, it affects your head. Sometimes you start having headache. Sometimes your cheeks are swollen. Sometimes your eyes, you're tearing up. A lot of things that started with the mouth is gradually,
Affecting other
diversifying to other
places.
parts of the body.
Mm.
Yeah. So anybody that has that kind of pain, try trismus is what we call it, like having difficulty opening well, that's with the jaw. I advise that the person meets a dentist, because in dentistry there are a lot of specialties. When you
Okay.
meet a dentist and the person is not able to handle that particular one, she or he would refer you to a specialist
That
that
will
will
take a look
handle
at
that.
this. Okay.
Yes,
Okay. All right.
exactly.
So also I have another question here that says, are there any natural remedies for dental cavities?
Oh, natural remedies. What I will actually say is how you can improve on your dental health, because once they are cavities, they're already there, except
Mm.
you go to the clinic for probably filling
Fillets or
when it can still be redeemed. Yes. So if there is already an existing caries or cavity on a tooth, the best thing is to run to the dentist at
dentist.
that point in time. You can actually redeem that tooth. But while at it, most times people make the mistakes of picking it with, maybe the wooden toothpick. Sometimes unconsciously as you're doing that, you're drilling more hole than
Oh.
it already has. All right. So the
Mm.
best thing is, even while you're taking care of it, it's also important that you go to see your dentist. And sometimes the pain is even too much that when you're brushing, you don't want to go to this
That
side.
side.
Like you're running away from that, you're running away from that part of the jaw,
Mm.
or the teeth rather. You're brushing the other part, not knowing that food particles, the
It's
bacteria and
coming
all of
there.
that they're all moving to that thing.
Oof.
Exactly, and dreaming and doing a whole lot of things behind the scene. And sometimes you'll be like, "Ah, the pain is not too much, I can just manage it." And as you're managing it, it's drilling more things that are happening. The more before you know it, the tooth is gone before you get to the
Wow.
dentist. So while it's important that you still try to brush, gargle, and all of that, so that food particles don't go to
Or
dirty
there.
part, it's also
Mm.
important that you run to your
Your
dentist.
dentist. Hmm. Wow. Thank you so much. Are you still there?
Then so that it can be filled up. That's if the that time, yes. Okay.
All right. Thank you so very much for answering those questions, and thank you for spending your time with us this afternoon. So just tell us, about the care that we can give to our mouth. I will try my possible best to visit a dentist soon, so I can have my tooth clean again. It was a fantastic experience when you guys did it for me. So maybe I was enjoying it and saying, you know what, I would rather like somebody who knows what they are doing to handle it. But thank you so much. What would be your final words for anybody out there watching this video?
Matter a lot to, first of all, the people that love you and to yourself. So it will be a demerit for you not for you to take care of every other part of your body, look good, your makeup, your wears, and all of that. And you can't even be able to smile in public the way you ought to, because there are some things that you're not very proud of and all of that. So as much as it's important to look good, smell nice, and all of that, please remember, if not for any other thing, to take care of your teeth. Your teeth also matter. That's just it.
Thank you so much, Gloria. It's been a pleasure chatting with you. Thank you for sharing your
Thank
knowledge with
you.
us. If we want to connect with you, how do we connect with you?
Okay, on Instagram, at Gloria Kasi, at I am Gloria Kasi on Instagram. I also have a YouTube channel where I talk about life,
Yay!
family, life, family, and dental health. Of course, I can't leave out that part. You know
Of
now.
course.
Okay, and on Facebook, I am Gloria Kasi
All
Arinze.
right. So all the
So
links to your
that's just
to
it.
your social media handles will be added to the description of this video when it is ready to be out. Thank you guys for being here with us today. You see, I made this one shorter than normal. I hope you guys are happy now. Thank you, Gloria, for being here again. Thank you guys for watching. Until I come your way again with yet another fantastic guest on eChat with Energetic EJ, do remain wonderful. Bye.